Okay, we are live. All right, I am Lindsay Vidal, and Shalom Fomenung, Shelby Gruel, and Kiko Violetta make up our group. Our group is studying the infant mortality rate in Brazil, and we have chosen to take on the issue of the high infant mortality rate in Brazil. And we have come up with a project that we named Every Life Matters, and the idea of how we intend to help to reduce the high infant mortality rate in Brazil. So I will start with some background information on Brazil and why we chose this as our group project. Brazil has a significant record in the high amount of infant mortality rate among its people. It has a highly diverse population because of the really congested cities and also the rural villages in the outskirts in Brazil. One of the Millennium Development Goals of the United Nations is to help developing countries like Brazil find a way to set the goal of having an infant mortality rate less than 16%. Since 1990, the children under 5 mortality rate has dropped by 47%. Not too recently, Brazil's infant mortality rate was as high as 24 deaths per 1,000 live births in 2006. Earlier to this time, the infant mortality rate was a staggering 60 deaths per 1,000 live births. Today, nearly 17,000 fewer children are dying each day, and 6.6 million children under 5 have died in 2012. Most of these deaths are from preventable diseases due to inoculations that the children are not receiving. The reasons behind these numbers for Brazil is because of a poor economic government that has scarce resources to help them. Brazil is well known for their indigenous communities and the way the people live the lives of their ancestors for the last thousands of years. And although Brazil has many ranches and they're rich in cattle and beef, particularly right now, their population is segregated from the cities, and they each have their own defined systems of rural governings. This segregation from the governmental resources are a big part of the reason rural villages have a higher infant mortality rate than the urban cities do. Just recently, the city of Rio de Janeiro was in the national news for the poor living conditions referred to as slums around the city, and that the government was moving them in order to make way for the FIFA World Cup. The Brazilian government has struggled with their priorities and economy for decades. Programs to battle health sanitation, public health, and other assistance to educate the people about the high infant mortality rate have been non-existent, if any. In July of 2013, there were huge protests against the billions of dollars of the government was spending to develop the FIFA World Cup. The people could see the government raise the money for FIFA, but has been unsuccessful in raising money for its own healthcare infrastructure. One solution may be other developed nations could put pressure on Brazil, emphasizing that they could offer Brazil the World Cup Games as long as they start programs to show success in lowering their high infant death rates. The FIFA World Cup would be a huge bargaining chip to get Brazil to set in place many needed public health programs that would help the people long term. There are also other programs that have helped mothers in the basic health care and eating. One of them is the Pastoral de Sinacra. Voluntary workers go across the country working to teach the population about basic health care. Another program would be Brazil's Milk Bank program, which started to turn around Brazil's infant mortality rate. In the past, Brazilian mothers would sell their breast milk to help support their family. this led to mothers depriving their own children in hopes of making a couple of bucks to support their family. So a milk bank was set up where the donation of milk from networks to the donation banks is common practice. So when a mother is unable to feed her baby, the network comes in to offer free milk for the families. We kind of grew our project based on this idea, and we thought we would expand and not just focus on the breast milk, which obviously is essential, but we thought we would tack on vaccinations and well care checkups for the infants as well, and that we could visit the same villages and create a relationship with these mothers, and they could bring their children in every 3 months, their infants in every 3 months for well checkups, inoculations, and we would be able to keep these children and mothers healthier and reduce the infant mortality rate. So Shalom will go into our goals and our plan implementation now.
All right. All right. Our goal of this project is to dedicate is to provide neonatal care and services to the infants in the rural areas and the villages, countryside, just to reduce the infant mortality rate through education and vaccination. And we want to improve the overall health of the mothers, prenatal care, and newborn care. I want to talk about some strategies that we had. We put together going into this that is going to hopefully help our project. One of them is, first of all, we want to locate all these local the stakeholders and clinics, midwives in the village who are often the ones who help deliver newborns and other guidance and education to the mothers. We also plan to locate local convergent places to spread messages. We want to find these women or spread our messages in places like the market, trade centers, churches, clinics, sporting events, and even entertainment venues like the local rodeo. Hopefully, we're working with the local clinic where we get to build some trusting relationships with the families and particularly mothers to be with infants needing additional care and vaccinations. We plan to record each mother to be an infant in the program to track their progress and ensure that they make every appointment and on time and receive vaccinations and education. We also will provide incentive for these mothers to commit to the program and ensure that they come every time. We will provide for the incentive. We'll provide things such as baby food, baby blankets, diapers, baby clothing, and birth control. We also plan on offering transportation to a lot of these mothers who have more than one children and who may not be able to travel so many miles to come to us, because we would really like to get to reach as many mothers and kids as much as we can. Since we have identified the stakeholders and in the areas, we also need to implement the program. So the first step is to have meetings in the various local gatherings and advertise our hours and locations of the times when we'll be meeting. And so we also plan on, this is also when we advertise our time, we're going to do it between 3 to 5 days before our program is actually going to happen, so that they know it's going to happen at that particular time. We will also ensure the mothers that they will be, we want to ensure that they'll be back every 3 months to make sure that every mother and infant understand when and where to come back and see us. So communication is a key. So we want to make sure that we reach every mother. The next step is to ensure training program for the local clinic doctors, midwives, and healers who can take this information, equipment, and vaccination services to their families. We work alongside the village doctors and nurses. We're very grateful to work with them, and I know they're grateful to work with us because at the end of the day, we will leave everything with and the new equipment back to them to take care of their patients. Um, um, as the mothers and children from our program show success, they can refer friends and families and loved ones to our organization and help grow our program, which is what we are hoping will happen. The local doctors and nurses would return and our team with our team every 3 months for 1 year to administer checkups and vaccinations. And we also talked about just some minor problems that we could come across during that program that we want to state it that way. If it comes across, we can tackle them. Um, One problem we talked about was to ensure that um, every mother, that we get as many mothers with infants, mothers to be, and small children to come to the local clinic while we are in town. Another problem might be getting the same parents or people to return to see us every 3 months. So excellent communication will be the factor for our success. Another factor could be uh, funding our project for a year, so we would definitely need donations from baby food makers such as Gerber, donations for clothes, diapers, donations like Pampers and Huggies, and donations for birth control like condoms and etc. So there you go, Shelby. Thank you.
All right, now I'm going to talk about funding and some different grants that we found. I narrowed it down to just 3 foundations, and those foundations are RGK Foundation, the Bill and Melinda Gates Foundation, and the Ford Foundation. So we chose these grants because they seem to be most applicable to our program. The RGK Foundation actually has kind of a motto kind of thing. They try to provide money for programs that promote access to health services and to programs that promote the health and well-being of children and families. So we felt that that kind of tied right into what our program is aiming to do. We want to help lower the infant mortality rate in Brazil. The next foundation that we chose was the Bill and Melinda Gates Foundation. This foundation, we chose this one because they have a belief that all lives have equal value and that they also believe in helping those who are in urgent need no matter where they may be in the world. And we feel that this is just that. It is an urgent need that needs to be addressed. The Ford Foundation was also one of the grant opportunities that we would apply for. They have a philosophy that they just want to help advance human welfare, and so we chose this foundation because this will improve the health and welfare of those children in Brazil and their mothers. Some other ideas for funding were to start a website to promote our program and hopefully allow people to donate through this website. The World Bank possibly would help us with that. We also wanted to hold local fundraisers to raise awareness and hopefully motivate others to donate and volunteer for the cause. And then enhancing infrastructure. We also made a pamphlet, which I will share on my screen right now. If it loads. Let me see. Oh, I don't think it's going to let me. Well, the pamphlet just basically kind of goes over what our program is about and is a way for us to raise awareness in the local villages. It just basically goes over what they will be provided with. We included this paragraph. If you are soon to be a mother or currently a mother, we want to help you. We would like to provide free checkups for your baby from birth to age 1. Those checkups would be every 3 months and would include the proper vaccines each checkup. We would also like to provide you with the right information you need when it comes to vaccinations and proper nutrition for your baby. Antibiotics will also be given to your child if your child is sick with a bacterial disease. And it also includes the different benefits that different incentives that will come with when they show up to the clinic, and those are the baby food, the diapers, and the baby blankets, baby toys, kind of things that Shalom was mentioning before. We also did a translation of that into Portuguese, so we are able to communicate with it. They're able to read it and whatnot. Yeah, the screen share isn't working, so. Okay, Shalom can talk about the questionnaire now.
Okay, so we also included in our project a questionnaire that Kiko was gonna talk about. The questionnaire is gonna we want to know about the women. We want to know about their medical background check. We would like to ask them questions such as, you know, starting with little questions such as their birth date, their current weight, are they taking any medications, and then go more in depth with questions such as, have they had any surgery before? How many children have they had before? How many children do they have? Are they allergic to any medication? Um, when was their last checkup? How many? When was the last time they received vaccinations? This will help us know if they've received any medical stuff in the past. This is just gonna give us some information about their lives moving forward. So, thank you. Yeah, Lindsay.
Okay, I was trying to show the questionnaire when you were talking about it. I think I got it to pop up, and then I was trying to find the pamphlet to share
Yeah.
for Shelby's, because it turned out quite nice. So I was going to add that. But so that is the the parts of our program. Our outcomes are, we hope to. Did you just read that part, Shalom? Or no?
Yeah. No.
Okay, all right. Our outcomes are, by ensuring that infants and children receive well checkups at specified intervals during the first year of life, especially, we can greatly reduce the infant mortality rate in Brazil by adding this benefit to each village. The intervals should be newborn, 3 months, 6 months, 9 months, and 12 months. And that we're hoping that by recording the information, the data before we start, and then recording it at each interval throughout our project, that we will be able to show success, and then we can start to travel to more distant towns and identify it through mapping, through the questionnaires, and the information that we gathered from each site that we visited. As we examine the data collected and see if the results have improved the overall infant mortality rate, we'll report this data to our funding sources, and if it's effective, advertise how well our program has changed the lives of those in Brazil. And so we should see to expand the program based upon the amount of successes that we have. So thank you.